All right. Hello, everybody. My name is Luke Kendrick, and this is my presentation on Providencia rettgeri. So, Providencia rettgeri, it does belong to the Enterobacteriaceae family, and within the Providencia genus, they are urease-producing and gram-negative bacilli. So, something I thought that was interesting is that they actually rarely cause human disease, even though they can be quite easily found throughout the environment. So if you are looking to isolate this organism, they can be found in wounds, the respiratory tract, and especially the urinary tract. And finally, here, they are actually often multiple drug resistant, and there are increased reports of resistance to carbapenems, which I will show you later on why that is important. So, some risk factors: immunocompromised. Um, that is normally a risk factor, and that holds true in this case as well. Also, if you're a hospitalized patient, this infection, at least from what I've seen, oftentimes occurs in hospitals, and within that, those with catheters. So, oftentimes, people with catheters, they are in a hospital settings. So, those with catheters, especially indwelling catheters, are much more likely to get this infection. And that is because of biofilms. So they form these biofilms on the surface of the catheter, and then they are also urease producing. So this just allows the organism to really survive and grow in those conditions. All right, for the disease, they mainly cause urinary tract infections. However, if left untreated, it can develop into something more serious. This can include pneumonia, meningitis, endocarditis, wound and bloodstream infections as the main ones. And then also, this is just something I found that I thought was interesting. It is also the causative agent of purple bag syndrome. Um, that is when your urine actually turns purple. So I included this picture here so you can see. If you look up pictures of it online, it's actually a quite vibrant purple, which I thought was just interesting. All right. On this slide, there is a lot of antibiotic names, and I won't bore you with naming them all out. But what I mainly wanted to show with this slide is that there is a lot of antibiotics that it is resistant to. And within the antibiotics that it is susceptible to, one of those is carbapenems. And as the literature was showing, there is just a lot of reports lately that Providencia rettgeri has actually acquired resistance to carbapenems. So this just further makes it more difficult to treat it because of its multi-drug resistance. So the mechanism of this resistance, for the majority of the, at least from what I've seen, it is mostly beta lactamases. Within those beta lactamases, you have AMP-C beta lactamases, which confers resistance to penicillins and cephalosporins. You have the extended spectrum beta lactamases. They are rapidly evolving, and they have the ability to hydrolyze third generation cephalosporins and astronam. And then here is a big one, carbapenemase. So carbapenemase, it is produced by uh, Providencia rettgeri, and it is able to break down carbapenem antibiotics along with most other beta-lactam antibiotics. All right. Before I get into carbapenemases, I thought it would just be good to go over what carbapenems are. So carbapenems, they're a broad spectrum antibiotic, and they are used to treat more severe bacterial infections, mostly as a last resort. And it inhibits cell wall synthesis, same as all the other beta lactams. But what's important about it is they are also mainly resistant to most beta lactamases. However, these carbapenemases, they are actually able to still hydrolyze these carbapenems. So these carbapenems, while normally are a last resort, they unfortunately don't work in this case because of the carbapenemases. Along with carbapenems. They can also hydrolyze penicillins, cephalosporins, monobactams, and of course the carbapenems. If you want to figure out if something is um, carbapenem resistant, you can just do a broth culture with some carbapenem in it. And if the minimum inhibition concentration is a little bit higher than expected, then that is normally a good sign. All right. For treatment, it can vary. It can vary. So the extended spectrum beta lactamase rate, if it's on the lower side, you can you would use different antibiotics. So you would use ciprofloxacin or this ceftriaxone. That's just some of the ones you could use. But if it's at a higher rate, you would use meropenem. Um, Once you would give these antibiotics, you would at the same time be doing a susceptibility test. And then once you get the results back from that, you could hopefully de-escalate the amount of antibiotics that you're actually giving to reduce the amount of harm you do to the patient. Prevention and control. So with most things, wash your hands. When it comes to Providencia rettgeri, we mainly just want to keep it out of potentially immunocompromised in patients' rooms. So that mainly looks like keeping it off of the healthcare workers. So sterilizing and cleaning medical equipment, proper hand hygiene. If you know somebody has an infection, implement contact isolation. So try to minimize contact with other people, family members, that sort of thing. And then the health care professionals who are actually helping that person, they should be wearing proper PPE. So your gloves, your gowns, that sort of thing. Judicious use of antibiotics, and then also, if possible, remove that catheter early. If you can get the catheter out early, it just prevents more complications. All right, so for a summary, the main take home points is that it rarely causes human disease, but when it does, it's usually in a hospital setting related to catheters. However, if you manage to get an infection, it can be tricky to deal with because of the multi drug resistance. And that is due to the beta lactamases like the carbapenemase. Um, that is why, if you are a healthcare provider, you should really ensure that you're using proper precautions to prevent the spread of Providencia rettgeri in your healthcare facility. All right, for my activity, I have just one question for you. What antibiotic does carbapenemase inhibit? A, just carbapenems. B, penicillin, sulfosporin, monobactams, and carbapenems. And then C, tetracyclines. So pick your letter, whatever one you think is right. And it is B. So if you chose B, you got it right. All right. And here is my list of references. Thank you, everybody, for watching.